the stuff, the neurotransmitters, the GABA, the dopamine, the glutamate, the endorphins, to name a few random transmitters in no particular order.
Well, I think you've summed them up rather well. You obviously read them. Yeah,
I've read the book.
alcohol has a stepwise interaction with the brain, and the first effect is to enhance the activity of this neurotransmitter GABA. GABA is not a transmitter that many people have heard about.
So it's GABA first.
Gamma aminobutyric acid, yes, but it's hugely important because it's the brain. It's the off switch of the brain. It's the calming neurotransmitter. It dampens down brain function.
Is that where the benzodiazepines work? The Valium, Librium type drugs?
Yes, they work on the GABA receptor. Types of the GABA receptor. I won't go into the complexity of the system because it's very complex, but the reality is that things that calm you down tend to enhance GABA, right. and that's most people drink because certainly in social situations we're a bit socially anxious. I mean, humans. I like to say this: humans are actually a really social species. I mean, we love to go to parties, but we're not very good at being social because we're always anxious when we go. Strange,
isn't it?
And even when we meet members of our family that we haven't seen for a while, there was that tension, and I think that's evolutionarily helpful. I mean, being slightly cautious of strangers probably is protective, but it doesn't help you get to know them. And alcohol, that first drink or so, enhances GABA, relaxes you, particularly in those parts of the brain which you need to relax in order to socialize. And that's great. And if we just stopped at that, then we'd be happy. But for many people, we can't stop. And when you start to increase the dose, you begin to engage other transmitters. You begin to release dopamine.
Right. Yeah.
And that's where people start to get activated. They get louder. They may get a bit competitive. They may get a bit aggressive. And the thing about dopamine is it's a moreish transmitter. You release dopamine. You like it. It's cocaine, amphetamine do that. But then as the levels fall, you want more. So dopamine is one of the transmitters which gets you addicted to alcohol.
And for me, it's the trigger dose as well. The amount of times I've said, I'll have a pint. And of course, you end up having more than a pint.
Yes. And that is partly dopamine. But also there's an interaction, interestingly, between dopamine and endorphins.
Oh, okay.
And they work together to basically encourage your brain to say, I need some more, I want some more. To chip away at the resistance. Oh, yeah. And we know that for instance, if you block the endorphin system, there was a medicine out there called normophine. You block the endorphin system, it reduces going for a couple of drinks to a binge because that seems to have an endorphin drive.
I mean, I tend to associate endorphins with morphine, opiates. Is that?
Well, it's exactly the problem.
Same transmitter.
Yes. So what morphine does, morphine mimics and exaggerates the effect of endorphins. Alcohol releases endorphins, but they both, in the end, there's still this propensity. Endorphins are painkillers in the brain, but they also have motivational role, and they also have some role in addictive behaviors, and addiction to alcohol is one of their roles.
So this is a real biochemical, neurobiological drug that alcohol is having. It's taken systemically. Yes. It goes through this blood-brain barrier and gets deep into your brain. What causes the? A lot of people ask me this: does alcohol increase sexual appetite, or does it just inhibit?
Oh, Shakespeare put it brilliantly.
Inhibitions.
It just inhibits you. He said.
Yeah, you're disinhibited.
It works to the effect that alcohol increases the desire, but messes with the function.
yeah. Although I wouldn't count on that. Especially for young people watching.
No, well, unfortunately, yeah. I mean, it's actually alcoholism is a very common cause of basically impotence.
Yeah. Eventually, yeah. So, what harmful effect does alcohol have on the body? I mean, I once met a man, and he said, "John, I like to drink tell me how I can drink as much as possible without harming myself. Interesting the way sometimes this mentality works, but you know, what are the main harms that alcohol has on the body? Probably thinking more. I mean, obviously you can get drunk and fall down the stairs. I mean, there's a common diagnosis in A&E. I'm sure you have it in psychiatry. It's called PFO.
Remind me.
PFO. It's a family show, so let's say Pede fell over.
Quite.
Is he a PFO? Go and see to the PFO in cubicle 3. It's appalling when you think about it.
It is, but it's hugely important.
Yeah.
Because alcohol is probably the only drug that we can image the brains of people who drink and show they're damaged by alcohol. Even drugs like cocaine don't produce objective changes in brain function that alcohol does. Alcohol shrinks the brain, but it also damages the brain. But part of the damage, particularly in men, is due to that kind of violence, accidents, fights, traffic crashes, etc. Brain injury occasioned by being drunk. So that's the first thing, I suppose, to say. If you want to avoid harming your brain when you're drinking, don't stand up, because falling over is a problem.
Oh yeah.
But on a more serious note, alcohol, there's almost no organ system in the body that alcohol doesn't harm. Yeah. And you kind of know that. I mean, everyone knows, when you have a cut, you put an alcohol spray, to kill the bugs. Well, if it's killing bugs, and bugs have pretty tough capsules, it's going to kill neurons, and it's going to kill other cells in your body. And that's what it does. Alcohol and the metabolite acetaldehyde, they're both relatively toxic. So wherever the alcohol gets, it starts to irritate. It irritates the mouth, and it's associated with increased levels of mouth cancer, particularly in smokers, because the two, alcohol and tobacco, have an aggregative effect. It's associated with esophageal cancer because it burns as it goes down. It's associated with stomach cancer and stomach ulcers. It's strongly associated, obviously, with liver cirrhosis. People often don't realise, though, more people die of alcohol-related hypertension and stroke than die of cirrhosis. It's one of the few preventable causes of hypertension. In heavy drinkers, it causes cardiomyopathy. The heart just swells and becomes not very functional. And then, of course, it damages the brain, and it shrinks the brain and kills neurons. And it's a major it's one of the few preventable causes of dementia.
Yeah, and the peripheral nerves damage as well, can't they?
Very much so. But yes, of course, that when people become alcohol dependent, they often become vitamin deficient. They lose sensation in their toes and their ankles, and they get tingling. They get peripheral neuropathy, which then aggravate. They trip over as well and cut themselves, and that.
So a question I get asked really quite often is it true alcohol kills brain cells?
Yes.
So alcohol is killing brain cells directly?
Yes, it is. It's killing brain cells by turning off another neurotransmitter we didn't get to, which is called glutamate.
Oh, right, yeah.
And here's the paradox. So when you start to forget, when you start to get alcoholic-related amnesia, that's because alcohol blocks the glutamate receptor in the brain. Now, the glutamate receptor is the receptor in the brain that keeps you awake and alert. And that's why, in the old days, people used to use alcohol as an anesthetic, because it dampens down the on switch of the brain, the glutamate switch. So it impairs your memory. So even if you could feel the pain, you didn't remember it. Now, the problem is glutamate is essential to your brain function. Your brain knows when it's being impaired, when the glutamate's being blocked. So it compensates. And it compensates by making more glutamate receptors to try to offset the effect of alcohol. And the brain's good at doing that. Turns on more receptors. And that's one of the reasons why people can drink a hell of an amount over a night and not be anaesthetized or falling over, because the brain is compensating. But when they stop drinking, the alcohol levels in the brain fall faster than the brain can readjust It's glutamate receptors. And that's why you get a hangover. And there's also this recently named but long known phenomenon called hangxiety. People are very anxious when they're coming out of an alcohol binge.
Yeah.
And that's because there's too much glutamate in the brain. And we know that glutamate kills neurons. Too much glutamate kills neurons. And that's why you have GABA in your brain, to make sure the glutamate isn't overactive and killing neurons. But there are situations where you have too much glutamate, like in epilepsy, where we know neurons die. And the same is true for alcohol withdrawal. It's the withdrawal of alcohol that is really toxic to neurons.
So alcohol is going to suppress glutamate. The brain makes more glutamate to compensate.
Correct.
The alcohol goes away from the brain because the liver metabolizes it. But the brain is still overcompensating and producing more glutamate, which makes you feel basically terrified.
Correct. Anxious, fits. People have fits in their alcohol withdrawal. Also, it turns on the sympathetic nervous system, so you get this heart pounding and your blood pressure surging. Yes.
The glutamate stimulates the sympathetic nervous system, the fight or flight.
It does. It drives the sympathetic nervous system in the brain, and that then goes into periphery.